Hey everybody, we're going to go through medical terminology about body systems. I think it's easier to learn, and this will, as we finish this up, this will round out our medical terminology unit. I'll give you, posted to this, I will post the words that you will need to know. They even have the definitions, but this will be um, how this is set up for you to kind of go through and learn a little better, and then definitely to get ready for your test. Give it just a second. It's a little slow. This a little slow today. We may review some things you already know, but all of these things are important, and we will definitely use them the rest of the year. So don't just memorize things for a test. Be sure you learn them. Whoops. All right. So there's levels of organization of the human body, and I want you to know them from smallest to largest. And the reason why we start with this is because we are going to learn about um, different parts of the body using medical terms, but we're also going to do some anatomy this year. So the cell is the smallest living part of any organism, and it has a membrane, it has organelles, and it has a nucleus. The membrane and the cytoplasm, they keep everything structured and inside the cell where it goes. Um, Humans have eukaryotic cells, so with the eukaryotic cell of a human, we have the nucleus that helps with regulation and making sure all the functions of in the cell happen. Or it's kind of like the cell brain. Um, it has different organelles. It has a mitochondria. It has chromatin. It has a Golgi apparatus. It has a endoplasmic reticulum that's rough and smooth. So hopefully you guys learned all of those different things. And we have multiple types of cells in our body. We have osteocytes. We have for the bone. We have cells in all that make up all part of our body. We have muscle cells. We have skin cells. So we have cells throughout the body, and those cells come together to make tissues. Tissues are multiple cells that have the same function, like muscle tissue. So muscle tissue will form like your bicep or your tricep or your quadricep. Osteocytes come together to form a bone, like your fingers, your phalanges, your fingers. Then that tissue works together to make organs. Organs like your two or more types of tissue form an organ. Organs like your heart, your liver, your kidneys. And then those organs work together with other organs to make an organ system. And when all those organs are together, they make a whole organism, which would be us as humans or another type of mammal. So the body can be sectioned into multiple planes. Sorry, I have a little bit of a cold or allergy issues today. So what you're seeing there is the different planes the body can be cut into. A mid-sagittal or sagittal plane is cutting is here, and it's cutting the. Oops, I'm sorry. Let me go back. And it cuts the cell, or cuts the human, or cuts the object into left and right halves. So it could be a mid-sagittal plane of the brain, of an organ, of a cell, or of the body itself. Mid-sagittal cuts things into left and right halves, equal left and right halves. The coronal plane cuts something into a oops, I'm sorry guys, I'm having technical issues this morning. The coronal plane cuts it into front and back. Coronal cuts it from the front to the back. So the coronal plane separates the anterior and posterior of the front and back of the body. The transverse plane is a horizontal plane that cuts the body into inferior and superior portions. So where mid-sagittal cuts it into medial and lateral portions, or right and left portions, the coronal plane cuts it into anterior and posterior, which is front. Anterior is front, posterior is back. Transverse cuts the body into a horizontal plane, which is inferior at the top, superior at the bottom. And that transverse plane is at the umbilicus, or the belly button. Okay, so these are cavities of the body. Also other sections of the body. The back of the body is posterior portion is also called dorsal. Dorsal and anterior mean this. Dorsal and posterior mean the same thing. They mean the back side. Ventral means front, and so does anterior. Anterior and ventral mean front. So in your dorsal cavity, you have two cavities within that: the cranial and the spinal cavity. The cranial cavity houses the brain, and the spinal cavity houses the vertebrae. So the dorsal cavity, which dorsal also means posterior. Posterior and dorsal mean back or towards the tail. They house the cranial cavity and the spinal cavity. The cranial cavity is where your brain is, so cranio means brain, spine, and the spinal cavity. Then the ventral cavity has three different cavities, or maybe you could even consider them four cavities if you think about it this way. So the ventral cavity, ventral means anterior and ventral both mean front. You need to know what dorsal, anterior, cranial, you need to know what those mean. Cranial pertains to the brain or to the skull. You need to know what ventral means. You need to know what those planes we talked about earlier were. Ventral means front or anterior. Anterior also means front. And inside the ventral cavity, you have the thoracic cavity. The thoracic cavity is where you have your lungs and your heart. It is separated from the abdominal cavity by the diaphragm. So everything above the diaphragm, your lungs and your heart, are all within the thoracic cavity. You also have the ribs to protect that area. And in the middle, the heart is in what we call the mediastinum. The mediastinum means middle. Medi means middle. So the mediastinum is where the heart is located. And then you have these two, you have your lungs. Those are all in the thoracic cavity. In your abdominal cavity, you have your stomach, your liver, your pancreas, and your spleen, and then part of the large intestines, and your large and your small intestine. And then in your pelvic cavity, you have your reproductive organs and your bladder. All that are in your pelvic cavity. And then sometimes the abdomen and pelvis are considered the abdominopelvic cavity. So that's where all of your everything below the diaphragm is, from the diaphragm to the pubic area. Those would be the abdominopelvic area. But that's also separated in your abdominal cavity, which is where your stomach, your pancreas, your liver, your spleen, and your intestines are. And then your pelvis has your colon, your rectum, your bladder, part of your ureters, which are part of the tubes that go down from the kidneys, which the kidneys are all also in part of the abdominal and part of the pelvic cavity. So those are your body cavities. Now, we're going to go through some questions as we do this, because I think that this will help you guys kind of prepare for the test, and that's why I have it this way. What is another term for dorsal? Another term for dorsal would be I didn't mean for it to do all, so I try to answer these questions. And what is another term for dorsal? Another term for dorsal would be posterior. Another term for ventral would be anterior. Now, the two cavities in the dorsal cavity would be the cranial and the spinal, and the cavities in the ventral cavities would be the abdominal, the pelvic, and the abdominal pelvic, and the thoracic cavities. So those are some very good potential questions you may have on your test. So as we go through this slide, I would be sure I knew this information for sure. Also remember that the body can be separated into planes. You have a mid-sagittal plane, which separates it into equal left and right sections. And the mid-sagittal means medial. Medial means middle. Lateral would mean away from the middle. So those would be the left and the right sides of the body. Posterior means back, and so does dorsal. Ventral means front, and so does anterior. The dorsal cavity, or that back cavity, has the cranium, or the cranial and spinal cavities, which means it has the skull and the vertebrae, and then the brain and the spinal column. The ventral cavity has the thoracic cavity, which has the lungs, the heart, and it separates the abdominal cavity by the diaphragm. The diaphragm separates the abdominal and the thoracic cavity. In the abdomen, you have your stomach, your liver, your pancreas, your spleen, and your intestines. And in the pelvis and part of the kidney. And in the pelvis, you have the pelvic cavity. You have very little bit of the very tips of the kidney, the ureters, which are the tubes that go down to the bladder, your bladder, and your reproductive organs, your ovaries, the part of the colon. They're all there. And then remember that the abdominal and pelvic cavity can be called abdominopelvic. That's both of those, that whole front section. So the abdomen also has quadrants. Normally, we think about it being separated into 4 quadrants, but it can be separated into more. We're going to talk about the first 2 quadrants initially, or it being sectioned into a horizontal and a vertical line, where you have an upper right, upper left, lower right, and lower left quadrants. So that's how we do the whole abdominal pelvic cavity. When we want to separate the abdominal pelvic cavity into quadrants, we have an upper right, an upper left, a lower right, and a lower left. In the upper right cavity, we have the liver, some of the large intestines, the gallbladder, the pancreas, and a little bit of the stomach. In the lower right, we have, and part of the kidney, we have some kidney, we have large and small intestines, part of the colon and the small intestine. In the upper left, we have most of the stomach, the spleen, a little bit of the pancreas, more of the large intestine and small intestine, and then part of the bladder. The bladder is kind of dissected on both sides. You have, for a female, you have right and left ovaries and part of your uterus. And then for males, we have part of the urethra there. Now, the 4 divisions provide reference points for us to they're used to describe where the organs are located. In clinical charting, we use that a lot. The location of abdominal pain in the upper right quadrant. Patients who have pain in the lower right quadrant, we have to be concerned about appendicitis, things like that. Also, it's how we talk about location of tumors. We talk about incisional sites. Is it a low transverse, or is it low transverse in the lower right quadrant, in the lower left quadrant? Do they have a surgical incision in the upper right quadrant from gallbladder surgery? So we do that. Also, when we palpate the stomach, when we don't hear bowel sounds, or when we feel things that are abnormal in the abdomen, we talk about it through quadrants. The 4 quadrants are what we use most often unless you are doing GI specific things. And then we may talk about it a little bit different. So now we're going to define, these are the abbreviations for upper right quadrant, right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. So you'll want to know those. Right upper quadrant, RUQ, left other upper quadrant, LUQ, right lower quadrant, RLQ, left lower quadrant, LLQ. We use those as abbreviations sometimes when charting. Now, for more specific issues, if someone is having specific pain and maybe in the center of the abdomen, maybe they have had a partial liver transplant. Maybe they've had their spleen removed. Maybe we're looking for some type of colon cancer or some kind of lesion in the body. Then we need to have more specific locations, like for MRIs, for CT scans, for certain x-rays. We need something that is more specific when we're talking about lesions, or lesions would be an abnormal scarring or abnormal tumor or abnormal, not being sure what it is, but it's an abnormal area on internally or externally. So then we take it from 4 quadrants to 9 regions for more very specific understanding. And so you guys need to understand these as well. So, and they're more related to body structures. Hypochondriac, that means the upper part near the ribs. So there you have the right hypochondriac, the left hypochondriac, and in the middle is epigastric. Epi means around. So the epigastric region would be around or near the stomach. So you have a right and left hypochondriac region in the very top, and then you have the epigastric, which would be in the center near the stomach. Then you have the lumbar region, and that's because it's called the lumbar region, which is the right and left side, because those are the sides, and the spine is near that area. So you have the lumbar spine. And so the right and left regions refer to the lumbar area, the lumbar portion of the back. So you have the right lumbar region, the left lumbar region, and then we refer to the center as the umbilical region. The umbilical region, because that is where your belly button is, or your umbilicus is. The lower 3 regions would be the right and left inguinal or iliac. You have an iliac tree there that's a large portion of arteries that help run down to the blood flow down to the legs. Or inguinal, because it's near the groin. So you have the right and left inguinal area. And then you have the hypogastric region, which hypo means below or low. So you have the hypogastric region in the middle. So if we talk about all the regions, we have the right hypochondriac region, the epigastric region, and the left hypochondriac region. And those are the superior regions of the abdomen, or the top. The medial or the middle regions would be the right lumbar region, the umbilical region, and the left lumbar region. And then the inferior or the lower portion of the abdomen would be the right inguinal, the hypogastric region, and the left inguinal. The 9 regions provide reference points. They're used for detection of internal organs. In the clinical, we look at those for abdominal pain as well, surgical procedures, incision sites, locations of tumors, and operative reports, or anything that's abnormal. If they're having a specific, very kind of a more pinpointed pain other than a larger regional area of pain. So now we're going to go back and we're going to identify those regions surrounding the umbilicus. If it's surrounding the umbilicus, it would be the umbilical region. Above the stomach would be epigastric, or Beneath the umbilicus or below would be the hypogastric. Then the lower sides near the groin would be the left inguinal or left iliac, and the middle section on the right middle side near the waist. So the right middle side would be the right lumbar. So not in the middle where the umbilical level area is, but on the right side, that would be the right lumbar. Okay, now we're going to talk about combining forms. We're going to do some exercises related to combining forms. And these are for cellular functions, okay? So a cell, the combining form for cell would be cyto. It just flipped on over. So it would be cyto. For nucleus, it would be carry or nucleus, and for tissue, it's hist. So nucleolysis would be like if the nucleus was destroyed. Cytology would be the study of cells. Histology would be the study of tissues. We're going to talk about, once again, we're going to refer to those anterior or front. We're going to do some combining forms for the positions and directions. Now, be sure that you are learning these because all of these definitely will be on your test. Once again, and we will refer to them throughout the year as we do anatomy, and we do other things when we are talking about healthcare positions and different things that we'll do. These will come in. You will use these over and over. Anterior or front. So I'm going to go ahead and move over. That would be anterior or anterio, means front. Medial or medio means middle. So the anterior portion of the body, or the coronal plane of the body, is also referred to as anterio. Middle is medi or medial. Lower or below means inferior, so that's below the center, below the belly button, or below the insertion point. Side means lateral, and back means dorso or posterior. So those are the combining forms that go with those planes we talked about earlier, and I kind of talked about those as well as we went along. So be sure that you know and you understand those. So we're going to look at the ones for the stomach. Stomach is gastro. Chest is thoracic or thoraco. Cranium or skull, either referring to the skull as cranio. Pelvis is kind of like what you think, pelvi or pelvo. Abdomen is abdomino, and then your lower back would be lumbar or lumbo, also can refer to near the groin area. Now we're going to talk about different colors related to the skin or blood or things like that. Red is erythro, like erythrocyte is a red blood cell. Albino or albino, that would refer to a whiteness of skin, maybe, or hair. Leuco we refer more to that when we talk about leukocytes, which is also what we call white blood cells. Black would be melano or melanocytes, or melanoma. If someone has melanoma, generally they have a dark area on the skin. Cyano means blue. So cyanosis would mean a blueness to the skin. Yellowing to the skin, or yellowing, would be Ciro, Jondo, or Xantho. So we generally refer to yellowing of the skin as jaundice, but we also can refer to people who have cirrhosis of the liver. It's a liver condition, and when someone has cirrhosis and the liver becomes hard, they're unable to break down what's called bilirubin, and then it causes that jaundice, that yellowness to the skin. So we're going to talk about some things that are also referred to some other combining forms. Dry would be zero, and there's a type of gauze that we use called zero form. And what it is it's a tightly woven gauze that has a kind of like a Vaseline on the outside to keep that um, like to keep a wound dry or the skin from drying out. An extremity is acro. People have something called acromegaly, and what that means is that their extremities continue to grow even when their body hasn't. So acro means extremity. Internal organs are related to viscer or viscero. So if someone has a visceral lesion, that means they have a spot inside their body or on an internal organ. Disease means patho. So like pathophysiology is the study of diseases of the body. And if you go in through anything in healthcare, you usually take a class called pathophysiology, and it's where they've kind of taken where you move on from that anatomy to learning how the disease processes function, and then what they do to the rest of the body. Unknown or a particular would be eti or etiology. Etiology is the study of how we study what we're not sure or how something originated. So now this is the way. Now that we're going to look at breaking some cells down. Destruction of white blood cells would be leuko. So that would be white. Cells would be leukocyto, and lysis means destruction. So you would have leukocytosis. Pertaining to the coccyx would be coccygeal. Resembling red would be erythroid. A black tumor would be a tumor of black cells would be melanocytes. So there you have your coccygeal, melanoma, erythroid, and then leukocytolysis. So that's how we break those words down. White means leuko, cell means cyto, and lysis means to destroy. Pertaining to, then when hopefully you guys looked up and you saw that there are about 15 different terms that can mean pertaining to. Eel is one of those. So let's try a few more words. Let's try a few more to put together. Pertaining to the neck. So the neck is usually referred to as cervical. So cervix. So cervical would be pertaining to the neck. An abdominal condition of yellow or yellowness could be cirrhosis. Abdominal condition of blueness would be cyanosis. Pertaining to the vertebral area that is in the loins or in the low back, that would be lumbar. Pertaining to a disease of an unknown origin would be etiologic or idiopathic. Pertaining to the body would be somatic. A specialist who studies diseases is a pathologist. Pertaining to internal organs would be visceral. So a lot of these we've already gone over, but these will definitely be words plus the list of words that I'm going to give you guys to start studying for your test. Your test will be next Tuesday. Not Tuesday this week, Tuesday next week. White blood cells would be leukocytes. Pain in the stomach would be gastralgia or gastrodyna. Dyna means pain as well. Gastralgia or gastrodyna. An instrument that measures the cranium, which would be a craniometer. Enlargement of an internal organ would be visceromegaly. Megaly means enlargement. Visceral means the organ. Incisions in the chest would be a thoracotomy. So otomy means an incision of, and then thoracic means the chest. Study of tissues, histology. Record of an x-ray, radiogram, because gram means record. So radiogram. Pertaining to a deficit in color would be hypochromatic. So chrome means color. Hypochromatic. Hypo means low or without. So some other things we need to talk about: a pathological or a morbid pathological or morbid condition that presents a group of signs or symptoms in clinical. So that's what pathological is. Pathological is a group of signs or symptoms. That means it's a distinct disease process. It disrupts the homeostasis, which means equilibrium. Homeostasis means equilibrium of the internal environment. Things that might cause that would be an elevated temperature. If they were febrile, afebrile, A means without, febrile means fever or elevated temperature. Hydration or full fluid volume in the body can determine it. And acids and salts, what are considered electrolytes. So acidity and salts would be the electrolytes, ions, and other salts in the body are what we call electrolytes. Those are things that help maintain homeostasis in the body. Homeostasis means a state of equilibrium or a state of normal function. So signs would be things that are objective. We can actually see signs. They indicate a disease. So a rash, a swelling, bruising, lumps, if there's redness, if there's loss of hair, that would be a sign. A sign of a disease is something you can actually see. It's objective and it's there. A symptom is subjective. That's something the patient describes that goes along with it. Nausea, dizziness, pain, numbness, tingling, ringing in your ears. You can't really hear that, but people will complain about that. Those are symptoms. So signs are objective indicators and symptoms are subjective indicators. There are different kinds of causes. Some are metabolic, some are infectious, some are congenital, some are hereditary, some are neoplastic, and some are environmental. So metabolic disorders would be like diabetes or thyroid disorders. Infectious would be like flu, pneumonia, things that you can contract from other people or you get due to an environmental cause. Sometimes, like maybe you have a cut and you go and lift weights and you get staph in it. Congenital would be something that you're born with. So like a cleft palate, or maybe someone's born with a growth or a birthmark. That would be congenital. Hereditary would be something that is genetically linked to you. So hemophilia, someone who has difficulty, hemo meaning blood, philia means they can't form blood clots. Neoplastic is cancer, where they have excessive proliferation of cells. And then environmental can be burns, it can be trauma, it could be related to abuse. It could be a disease related to extensive abuse. So maybe someone has excessively ingested medications, and it's caused disease processes like liver issues or kidney issues or heart issues. Those can be environmental if it's related to something that they have come in contact with. So here's some more exercises to help you guys with vocabulary. So adhesion would be when two tissues kind of adhere together. People have those after surgery sometimes, and it's really uncomfortable because they kind of stick together. Inflammation would be, inflammation would be the body's defense against injury, and it helps prevent the spread of bacteria or other issues, and it's characterized by redness, heat, swelling, and pain to that area. So if we cut our finger, and it gets red around it. It bleeds a little. That's the body getting white blood cells and platelets and starting to form a web there to make a barrier so that things from the external environment can't get to it. And it helps protect the body. Inflammation, the suffix for inflammation is itis generally. Like arthritis, arthro means joint, itis would be inflammation of. Febrile or fever means febrile means fever or pertaining to fever. And if you were afebrile, you would be without fever. So febrile refers to an elevated temperature. We have some more. Morbid, which can mean diseased or unhealthy. Sepsis is an infection that has gone to a pathogen in the blood or the tissue. Generally, if we think someone is septic, they have the infection in multiple areas. Suppurative means pertaining to the generation of pus. So other things that are important medical terms, an electrocardiogram. Electrocardiogram is where we place little electrode pads on different parts of the body. And then it does a tracing and makes an image of or a graph of the heart. So electro would mean electrical. Cardio means heart. And graphy means making a graph or a drawing of or tracing of. It's looking at the electrical impulses or the way that the heart beats. Also, there is another thing called the Holter monitor, and those can be worn for 24 to 48 hours. Sometimes people wear them up to a month, and it tracks the heartbeat for the entire time you're wearing a Holter monitor. Remember what a Holter monitor, that is a continuous electrocardiogram that can be worn anywhere from 24 hours up to a month. Spirometry, so that's how we do a pulmonary function test. People who have COPD or asthma, it's how we check the lung volume. So we take a deep breath in and then they blow air out, and it tells us what the tidal volume or what the volume of the lungs, the capacity of the lungs. We do a lot of incentive spirometry. If anyone's ever had any kind of surgery, we ask you to take a deep breath in and then blow out real hard, and that helps make sure that we get your lung function back to where it needs to be. We do it a whole lot post-operatively, but we do spirometry also with people who have, like I said, lung disorders, COPD, congestive, or sometimes people who have congestive heart failure need to because it's impacted the lungs, or people who have asthma. Spirometry, it aids in the measurement of lung disorders. It involves determining what lung function is, and once again, it's ordered after surgery or people who have other lung disorders. Anastomosis. Anastomosis is basically a surgical joining of two ducts, vessels, or bowel segments to allow flow from one to another. So we do anastomosis in a lot of different ways. Sometimes we need to do an anastomosis either end to end. So maybe they have to remove a section of the colon. So they'll cut out the disease section on each side where they have to remove maybe a cancerous or a blocked or of someone who has Crohn's disease. Maybe they have an area that's not functioning. They'll remove that part, then they'll stitch it back together or sew it back together, suture it back together. If we have one where they've added a section in, maybe they're having to bypass a certain section of the colon, or they're bypassing a certain section, maybe bypassing the stomach, or they're joining two together. So that's what anastomosis is. It's the surgical joining of two ducts. So maybe they need to, if you have to have your gallbladder removed, they may have to do that side to side anastomosis so that bile can flow or the intiside, depending on how much of the gallbladder is diseased. Biopsy is removal of a sample to determine whether or not usually it's used to determine whether or not something is cancerous. We do biopsies to determine if there's bacteria in locations where it shouldn't be. So there are different types. We can do tissue, blood, and bone biopsy. What you're seeing on the right is doing an aspiration of bone marrow from the pelvis bone. But we do skin biopsies, we do tissue biopsies, we do spinal fluid. We go in and we remove spinal fluid. We do remove portions of tumors to see if they're cancerous. So there's multiple kinds of biopsies, but it's removal of a sample to be evaluated. Biopsy is removal of some kind of sample to be biopsied, whether it's skin, tissue, blood, body fluids. That's what a biopsy is. So here is a little bit of an exercise, and then we're going to stop. Mr. L has a saphenous vein excised and used to bypass an occlusion of one of his heart vessels. So he's having a CABG, a coronary artery bypass. Surgery that joins two vessels and allow them to flow free, then allow the free flow of blood between them, called an anastomosis, a scan, or a vasculectomy. Oops, I'm sorry, guys. So it would be an anastomosis because they've taken two vessels and they've grafted them together so things can flow through it. So that would be an anastomosis. A scan would be like a CT scan where they look at the internal images. A vasculotomy would be actually a vessel removal. Mr. W is told that deep breathing postoperatively is essential to avoid lung complications. The doctor instructs her to use an incentive spirometer. This device helps to prevent fluid buildup in the lungs. So that's what that is. That's making sure that they don't develop pneumonia. Okay, we're going to stop here for today. You guys have a great day, and I will be back with you later. Thanks so much.